My name is Michelle Henry. I'm with the University of Texas at Arlington School of Nursing, and today I will be lecturing on the bisphosphonate medication called Alondrate, also known as Fosamax, for osteoporosis and postmenopausal women. This is a 2-hour lecture for BSN students in a classroom setting. The ages and education level are varied between 18 years and retirement age. There are first-time students in here, as well as students with previous degrees in education. So let's start off talking about the lecture and what we want to learn by going over the objectives. By the end of the lecture, the BSN students will be able to, 1, explain 2 physiological ways that Fosamax treats osteoporosis. 2, describe 2 patient education factors regarding the administration of Fosamax. And 3, list 2 contraindications of Fosamax. So let's start off by talking about the background of osteoporosis. Osteoporosis in postmenopausal women causes their bones to become weak and brittle, causing fractures of the hip, spine, or wrist. Approximately 1.5 million women in the United States are affected by osteoporosis and fractures, and this leads to chronic pain and poor quality of life. After a woman has reached menopause, estrogen levels decline, putting them at high risk for decreased bone mineral density and fragility. Usually there are no symptoms of the early stages of bone loss, but as the disease progresses, they may experience back pain, a decrease in height, or possibly a fracture that happens much more easily than it should have. Treatment options are aimed at strengthening bones by medications, diet, exercise, and other lifestyle choices. So to understand osteoporosis, let's start talking about how this happens in the body. As we grow, our bones are in a constant state of renewal, building and breaking down bone. This physiology is called bone remodeling, where the body uses osteoclasts to break down bone through resorption and osteoblasts to build new bone through mineralization deposits. Osteoporosis occurs when this homeostasis is altered and resorption happens faster than the building of new bone, leading to decreased bone density and fragility. After menopause, the estrogen excreted by the ovaries declines, resulting in decreased bone matrix and decreased calcium and phosphate in the bones. So I'd like to talk about a medication today that is very commonly used for osteoporosis. It's under the drug class called a bisphosphonate, and the drug is alendronate, also known as Fosamax. And for the remainder of this lecture, I will use Fosamax to describe the medication. The bisphosphonates are the very first choice of therapy when a woman is diagnosed with osteoporosis. Their mode of action is to inhibit osteoclast activity of resorption, thereby stopping the breaking down of bone and allowing osteoblasts more time to build bone. The expected outcomes are we expect Fosamax to prevent further bone breakdown and promote bone remodeling. Some things to know about Fosamax: it is an oral medication. It is given daily or weekly every morning with a 6 to 8 ounce glass of water on an empty stomach. The patient must also remain upright for 30 minutes to optimize the health benefits and decrease the GI side effects of nausea, dyspepsia, or abdominal pain. This medication is approved by the FDA, so it is considered safe. However, there are 2 major side effects that the patient should note about, and that is an atypical femur fracture or osteonecrosis of the jaw. The medication has been proven effective in a random control trial involving postmenopausal women with low bone density. The rate of spine and hip fractures was significantly lowered by 50%, and the rate of non-spine fractures was lowered by 20%. There are some contraindications with the medication. It should not be given with calcium, antacids, or iron because it interferes with absorption. It should also not be given with aspirin or NSAIDs because that could interfere with Fosamax and lead to further GI upset. Prevention, modification, and restoration of lifestyle include strategies to prevent future fractures and strengthen bone density. The bisphosphonates, such as Fosamax, prevent osteoporosis by halting further breakdown of bone, thereby allowing the body to rebuild bone mass and increase bone matrix. Women may also have to modify their lifestyle since Fosamax does need to be administered prior to eating on an empty stomach, and they must sit upright in an upright position for 30 minutes afterwards. Lastly, women should be educated on the benefits of weight-bearing exercises and the intake of calcium and vitamin D in conjunction with Fosamax to optimize the health benefits. So let's go over the main points of the lecture and link them back to the objectives that we discussed earlier. By the end of this lecture, BSN students will be able to, 1, explain 2 physiological ways that Fosamax treats osteoporosis. First, let's go over the physiology of the body. And this is bone remodeling occurs when osteoclasts break down bone through resorption and osteoblasts build new bone through mineralization deposits. First, Fosamax will stop this bone breakdown by inhibiting the osteoclast activity of resorption. And 2, once the patient is on Fosamax, this will allow the osteoblasts more time to build bone through bone remodeling. Objective 2, describe 2 patient education factors regarding the administration of Fosamax. This is an oral medication and it's given daily or weekly with a 6 to 8 ounce glass of water on an empty stomach. The patient also must remain upright for 30 minutes to optimize the benefits. And the side effects are related to GI, and they are nausea, dyspepsia, or abdominal pain. Patients must also know about the risk for atypical femur fractures as well as osteonecrosis of the jaw. Lastly, the third objective is to list 2 contraindications for Fosamax. Fosamax should not be given with calcium, antacids, or iron because it interferes with absorption. Aspirin or NSAIDs because that would also interfere with Fosamax and lead to further GI upset. So let's go over how we will be evaluated after this lecture. I would like for us all to get into a group and have a discussion to reinforce the key points that we learned. And some of the questions I want you to think about are, 1, how did this lecture increase your knowledge of osteoporosis and Fosamax? 2, describe how the mechanism of Fosamax treats osteoporosis. And 3, tell me how you would describe Fosamax to a patient, including drug contraindications, efficacy, and course of treatment. After this discussion, we'll go into a group activity and we'll do a case study about osteoporosis and Fosamax. And then after that, we will do a group post-lecture that has 4 questions. And all of these activities are made to reinforce what we learned today and synthesize information and have application of concepts. So this concludes the lecture today on osteoporosis and Fosamax. Thank you so much for watching and learning with me today.